Okay, thank you, everyone. Appreciate it. Want to get a full screen here. There we go, finally. Okay, again, everyone, welcome on behalf of the Bold Public Health Center of Excellence on Dementia Caregiving. My name is Joe Gogler. I am the director of the Bold Public Health Center of Excellence on Dementia Caregiving, and we are just thrilled that you're joining us today for what will be a very, very exciting webinar, Public Health Programs for Dementia Caregivers, Finding, Selecting, and Implementing Interventions that Work. So again, we really want to thank the Benjamin Rose Institute on Aging for co-sponsoring this particular webinar. Again, we're really excited with this fabulous panel that we've assembled and put together. I want to begin with a land acknowledgement. The University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values, courage, wisdom, respect, and generosity. So our center, the Public Health Center of Excellence on Dementia Caregiving, we are designed to support state, tribal, and local public health agencies, really in all things related to dementia caregiving. You see some of our major objectives here. If you are a public health agency, if you are a service provider, and you would want to seek technical assistance from our center, talk about ideas, think through certain activities or initiatives you are planning on, we are here to help. We have an incredible national network of leaders in dementia caregiving, some of whom you're going to hear from today. And again, we'll be providing information on how you can actually connect with us at the end of this webinar today. Really excited with our panel. Really, as I have mentioned in some of my promotion, these are some of the best people in the business when it comes to thinking about selecting an evidence-based intervention to support those unpaid individuals, family members, friends, others who provide care to people living with dementia. They include Donna Barrett from Summit County Public Health, Katie Maslow, a visiting scholar at the Gerontological Society of America, Dr. David Bass, Senior Vice President and Senior Research Scientist and Director of the Benjamin Rose Institute on Aging, as well as his colleague from BRI, Rachel Cannon, and then Aaron Long, who's the team lead for Alzheimer's disease programs at the Administration for Community Living. So what we'll ask you to do throughout the webinar is, as you have questions, please use the Q&A feature to submit them, and we will be answering them both at the end of the presentation and depending on how time permits, perhaps at the end of each presentation as well. So I am going to turn it over to our first speaker. And again, thank you so much for taking part in our exciting webinar today.
Hi, everyone. My name is Donna Barrett, and unfortunately, I'm having tech difficulty. So you're not going to see my face, but I'm going to pull up my slides so that you can, I've been disabled from sharing the slides as well. So if somebody could help with that, that would be great. We just tried this out and it worked, and now it's not working. So I'll wait for that, but I'll go ahead and do an introduction. So my name is Donna Barrett. I am a program manager at Summit County Public Health, which is in Akron, Ohio. And I am a licensed social worker by trade. Summit County Public Health is the county health department for approximately 541,000 residents, with a population of seniors, or about 13%, and with Alzheimer's disease being our 5th leading cause of death in Summit County. So you may be asking yourself, why is a health department looking at...
Donna, this is Joe Gogler. I'm sorry. I don't think we're not seeing your slides. Could you try to share your slides, please?
I am. It's telling me I'm disabled.
Okay. I'll have Alma look into this here.
Okay. I can wait if you'd like me to wait, or I can continue to talk.
Feel free to continue talking, Donna.
Okay.
Alma will eventually give
you should be able to share now. Sorry for the interruption.
Thanks, Alma.
Thanks. Perfect. All right. Okay, is everyone seeing them now? I can't see anybody, so if someone could just
Looks
say.
great, Donna. Wonderful.
Perfect. All right, I've already done the introduction. I talked a little bit about Summit County Public Health and why we chose to do programming for family caregivers. For one, we are required by law to do a community health assessment every year, and we do that community health assessment. And what we found was we have concerns about our aging population. We did a geriatric or an older adult assessment as well that showed that, and that caregiving was an issue. So part of our community health improvement plan was to address the needs of our growing population. And part of my senior and adult services strategic plan was to develop programming for caregivers and people with dementia. So as I said, in Summit County, Alzheimer's is the 5th leading cause of death for people over the age of 65. There's a cost of $1.1 trillion to provide care for folks with the Alzheimer's disease. And that 80% of our caregivers are providing all long-term care services for folks living with dementia and other diseases. What we want to do here at Summit County Public Health is ensure that people, older people, people with disabilities, and caregivers have seamless access to the services that they need so that their loved ones can age in the place they call home. And we want to make sure that we do that by developing evidence-based programming that's been tried, that has fidelity to it, so that we can achieve the best possible evidence-based outcomes for our population. Our program was made possible by a grant from the Administration for Community Living, with our grant number there. The purpose of the grant that we received was to address and increase community dementia capability within our county by identifying and assisting people who live alone with Alzheimer's and related dementias, to work with the intellectual developmental disability population through training their staff to be able to identify Alzheimer's disease, specifically in those folks who have Down syndrome, and to develop and implement evidence-based programming to address behavioral issues for family caregivers. And we chose BRI Care Consultation, and I'm going to tell you a little bit about how we went about doing that. First, we were provided a link to all of the approved evidence-based programs through the grant process. And what we did was researched this document. And on the document, what we discovered was that all of those evidence-based programs that were provided to us, we had a name of a program. We had the target population that the program was developed for us to work with. We had a description of the intervention. We had background information to the publications so that we can learn about the program, including reliability and validity. We had contact info to assess the intervention, or to access the intervention materials, and to talk to mostly the developers of the program. We were given access to current sites that were who implemented the programs that we were going to choose, and we had contact information for the previous sites that also implemented that. We internally here, externally with our partners, we chose to develop a program that would address both the caregiver and the person with dementia, and we had local support for that. And I must say that prior to us getting the grant, we weren't aware, and I don't think best practice caregiving was up and launched at that time. This was in 2019, and I think David will talk about that as well in just a few minutes. So what we did was we researched all the various programs that were available to us on the document that we received from ACL. We called the developers of those programs that we were interested in. We determined the cost for to implement that. Of course, the population to be served, we knew who we wanted to be served, and we looked at what the outcomes of those projects were before we made a decision on what to choose. We chose to implement the BRI Care Consultation Program, and there's a couple reasons why we chose that. First, I was familiar with that program because I work in Cleveland. I worked in Cleveland and had partnered with Benjamin Rose Institute in the past with clients and other programming. It was close to us, so we had access to the folks at BRI. They're like basically right in our back door. We can reach out to them. They're 30 minutes away. So that's why we chose that program. And we knew it would work with both the person who had dementia and the caregiver, and it focused on mentoring and coaching that caregiver, and a big focus on taking care of the caregiver. We implemented the program through press releases, highlighting our webpage, brochures. We do trainings about our program here, prescription pads for doctors. We do outreach in the community at health fairs for seniors and caregivers. We have an intra-agency partnership with other BRI care consultation providers. We've developed postcards through that partnership, flyers that we share, and a hotline. And so it's been nice for us because there are several programs in Ohio that are implementing this program, and we have the support of Benjamin Rose to do so. Just to give you some outcomes, we've had 17 referrals since I did the slide. We've opened 15 folks. Our preliminary outcomes indicate that we have actually had positive outcomes with decreasing some of those triggers from first assessment to reassessment. We've seen improvements in geriatric depression, caregiver well-being, and quality of life for the person with dementia. And some of the barriers, I think when I think about what David's going to talk about, and me being familiar with that database has everything that we needed, including the cost of implementation, who to contact, all the research articles. We did a lot of behind the scenes work before we chose which program to use. And just barriers to implementing the program have been COVID, staffing issues, outreach has been canceled, and funding sustainability. We are a health department. Typically, you don't see health departments doing direct care. We're a pretty good sized health department with about 180 employees, and our caregiver program here is one of the direct care services that we provide to our caregivers in Summit County. And that's basically what I have. I think we're going to hold off on questions. Please feel free to put them in the chat, and I will be here at the end of the presentation to answer any questions. And I think David Bass is up next.
Thank you, Donna.
Thank you.
Slides. So I'm going to start us off, and I'm here representing, along with Katie Maslow and Rachel Cannon, our Best Practice Caregiving project team. And just quickly give you a sense of the scope of this initiative. You can see on the left, this is a partnership between Benjamin Rose Institute on Aging, Family Caregiver Alliance, which is a California-based organization that has worked on caregiving issues for decades, and the Gerontological Society of America. We also have many collaborators. Bridge Builder Strategies is helping us with financial sustainability. We've added to our team the Diverse Elders Coalition and its member organizations, which are listed on this slide. I'll talk more about adding Diverse Elders Coalition to our group, but we are very interested in adding information to best practice caregiving for caregivers from diverse communities. And that's going to be a major focus of our work in the coming years. And finally, Quality Process is the company that we work with to develop Best Practice Caregiving as a website. Our funders for Best Practice Caregiving are the John A. Hartford Foundation, RRF Foundation for Aging, and Arstone Foundation. And these organizations not only provided financial support for Best Practice Caregiving and continue to do so, but they've been partners and collaborators right along and have had great influence on the quality of Best Practice Caregiving. So Best Practice Caregiving is really an initiative that responds to the nearly 15 million US family and friend caregivers that provide the vast majority of help and assistance for people living with dementia and other other conditions as well. But we really focused in on caregivers of persons living with dementia because we know from the research literature that these caregivers are really at greatest risk. And they have more adverse negative consequences reported by themselves because of caregiving. They assist with more tasks and oftentimes more difficult tasks. And some of the symptoms are particularly stressful for them. And the person living with dementia sometimes has a lack of ability to participate fully in their own care. I want to say from the outset, though, that caregivers are an incredibly diverse group of individuals, diverse in so many ways that to think of caregivers as one thing really is not appropriate. And we're going to get into this a little bit when we see the breadth of different programs that we have for caregivers. And Katie Maslow will talk more about that. So a major advance in the field of caregiving over the last 30 years has really been the development of proven programs, non-pharmacological programs with benefits for family and friend caregivers. Some of these programs not only help caregivers, but also help the person living with dementia and have proven benefits or proven outcomes for the person as well. And some of these programs are ready for scaling in communities. That means they aren't just programs that have been tested in controlled research, but they've actually been done in communities as real-world programs and have been shown feasible, and some of them implemented widely. The problem is that although we have many of these proven programs that are ready for implementation in communities, only a small fraction of healthcare and community organizations that could be doing one of these programs is offering them. There are multiple reasons why service organizations are not more widely implementing these programs, but one of those reasons is a lack of knowledge among professionals about these programs and that they exist and that it's tough if you're a professional to learn about these programs. Most of them have been published in the research literature that is not widely read by people outside the research community. A lot of those research articles, even if you find them, don't have a lot of information about the programs themselves, tend to focus on the statistical findings and the outcomes with some description of the interventions, but not a full description. So it's hard to get information about these programs if you're working in a service organization and you're trying to find the right program to match your organization. And it's even difficult to know if any other organizations are doing the programs and what their experiences have been. Now, we just heard Donna talk about her efforts, which are amazing. Donna's an amazing advocate for caregiver programs, and Summit County Health Department is a leading health department in the country around this issue. But she had to do a lot of legwork to learn about the different program options and coming to a decision that she made, along with help from the Administration for Community Living that Aaron Long will talk about in a few minutes. But that problem of limited knowledge among professionals is why we developed Best Practice Caregiving. Best Practice Caregiving was launched in January of 2020, and as Donna said, it was not available in 2019 when she was doing the work. We wanted to create, and we did create, a free, easy-to-use tool for professionals, and it's available now to everyone. You can find Best Practice Caregiving on the website of Family Caregiver Alliance, which is at caregiver.org, but Rachel's going to show you best practice caregiving in a moment, and you'll see the link to it. Best practice caregiving includes 44 evidence-based dementia caregiving programs that went through a review process that Katie Maslow is going to talk about, how we chose these 44 programs. For each of the 44, if you go to the Best Practice Caregiving website, you get complete program descriptions. You get information about the research findings. You get information about all the tools for delivering the program, what's required, how much does it cost to get permission, what kind of staffing you need, everything if you're an organization that you need to know to choose or compare programs. You even get information about the experiences of other organizations that have done these programs in the past. You can also find complete bibliographies of all the published articles on these programs. And finally, it seems simple, but it's not. You can get a name of someone to contact to find out more and really talk to somebody about what it would mean to deliver one of these programs. So contact information for that individual can be hard to find, but not anymore for these programs. You can go to Best Practice Caregiving. So we're going to go into some depth now to show you Best Practice Caregiving. And I'm going to pass to my colleague, Rachel Schaefer, who will give you a demo. And I'm going to stop sharing. Rachel.
Thanks, David. Hi, everyone. I'm going to share my screen here quick. And I'm Rachel Cannon. I'm a senior research analyst at the Benjamin Rose Institute on Aging. And I'm just going to do a walkthrough of the Best Practice Caregiving site. This is at bpc.caregiver.org. What you see here is the landing page. And here you can take a quick look at what information is included in the database. You can find out a little bit more information about how to use the database. So this includes information about the different sections in the database, including filtering through the different programs, comparing programs, and viewing the comprehensive program profiles. You can see here a list of our generous funders, the John A. Hartford Foundation, RRF Foundation for Aging, and Archstone Foundation. You can also learn more about how to stay in contact with us, including signing up for our e-newsletter. You can learn more here about the project, including who our collaborating partners are and our advisory committee. And then again, you can learn more about the program inclusion methodology, which Katie will talk here about in a little bit. And then just some additional information here at the bottom of the page. There's a link to our readiness questionnaire, which helps organizations know what they need to deliver a best practice caregiving program. There's a link to some of the frequently asked questions about the site, how to contact us, and our privacy policy. So just scrolling back up to the top of the page here, you can click here to view the different programs. And this takes you to the program search page. So you can see here all 44 programs are listed with a brief description and just a little bit of background information about each. And then there's a button to learn more about each program. You can use the search or filter bar at the top of the page here to filter by a program name or a specific description. So if you're looking for a specific program or description there, you can type it in here to search. And then on the left here, you can see all these different filters that you can filter down programs by. So I'm going to go through some of these just for examples. You can filter by the different types of dementia that the program is available for, whether or not the program is focused on other chronic conditions other than dementia, the different languages that programs are available in. So just for an example here, if I click on Spanish, excuse me, you can see that 18 programs are available to be delivered in Spanish, and that filtered down to those 18 programs. You can search by whether or not the program has a cost or fee to obtain a license to deliver the program. Just some different program components to filter by. The mode of delivery is a filter. So you can see here whether or not the program is available to be delivered by email, in person, telephone, or webinar and online. So if I click on this webinar or online here, it filters down to 6 more programs that are available by webinar. You can also filter by the different program recipients. This includes caregivers and persons with dementia, so whether the program is available to them. And then you can filter by the different types of assistance that the program provides and who receives that assistance. So again, caregivers or persons with dementia. Just some more additional filters here. You can filter by the type of delivery person. So whether a lay leader or professional or paraprofessional can deliver the program, or if the program's self-guided. You can also filter by whether or not initial training is provided for delivery persons. And then finally, you can also filter by the different study findings. So again, these are the outcomes that were measured in research studies for each program. This includes different caregiver outcomes and person with dementia outcomes, as well as service and utilization and costs and different satisfaction and feasibility outcomes. So just scrolling back up to the top here, you can see on the right, there is the compare feature. So you can compare up to 3 programs at a time here just by clicking the compare. And then I'm just going to select 3 programs here quick and click the compare now button. And then this brings you to the compare page. So again, you can see these 3 programs here side by side to compare the different information. You get a brief description up top and the ability to click to see the program in more detail if you'd like. But I'm just going to scroll through some of this information here to show you all. You get a program overview. Again, those types of dementia that the program is for, whether or not it's for any other chronic conditions, the different languages and target populations for caregivers that it's available in. You get an overview of the different program costs across all 3 of these programs. So some of the program cost information includes whether there's a base or certification cost, what's included in that cost, any renewal costs that you might need after a certain period of time, and then any additional costs beyond that base and renewal cost. You can compare some different program components here, specifically the different formats that the program's in, whether it's individually delivered to caregivers or persons with dementia or delivered within a group. The total program length you can compare, the total number of sessions, and again, that mode of delivery and who receives the program. You can compare side by side the different types of assistance that the program provides. So this just includes these different categories here and whether the caregiver receives this assistance or the person with dementia receives this assistance. Some different program characteristics include the staffing that's required to deliver this program. So the type of delivery person again, and then a lot of information about the different training for delivery persons that's available. So this includes initial training for delivery persons, and a little additional information about these types of training. So the total training time, number of sessions, and mode of the training. Whether or not refresher training for delivery persons is available after a certain period of time. If train the trainer is available for delivery persons, and whether supervisor training is available. So a little bit more information you can compare as well on the survey of delivery sites. So you can see those sites, those organizations that we surveyed about their experiences with the programs, how many completed these surveys, and a little bit of information about the organizations and the programs they delivered. So you can see here those different delivery site settings of organizations or what type of organization they were. And then some different site experiences. So this includes different perceived improvement ratings for different outcomes for caregivers and persons with dementia. Some different success ratings on getting both financial and non-financial resources and support for program delivery and recruiting participants. And then many different major or minor challenges that organizations faced with recruitment, with financial sustainability, as well as referring participants, marketing the program. So you can see the percent of sites that had an issue with that. And then again, just some additional satisfaction ratings on some of the different features of the programs, including that training, delivery tools, and manuals. And then you can also view the different funding sources that sites said that they used to support the program. And then the last part of the compare feature here, you can compare the different research evidence and study findings. So this includes caregiver well-being outcomes, support outcomes, and person with dementia well-being is along with the different satisfaction and acceptability outcomes. So you can just kind of view the different beneficial effects that were measured across these different research studies. So that's just a quick view of the compare feature. I'm going to scroll back up to the top here. And again, if you find a program that you want to learn more about in this compare feature, you can click here to see the program. And that's going to take you to the comprehensive program profile. On the left-hand side here, if you want to find out more information, you have the developer name and a contact name and information to contact someone for additional information about that program. Scrolling down, you can also view the complete bibliography and all of the program articles that all the research studies that have been done on the program that have been published. So this includes a link to each. So if you click on one of these here, it'll take you, if the article is available online, it'll take you to that article. So you can dive deeper into the research studies. And then I won't go through all of this. There's a lot of information here, but I just want to expand some of these program information boxes to show you. But if you click on program overview, again, you can see different target populations that the program is available for, any program costs that are associated with the program, and sources of program financial support. Some different program component information includes that conceptual or theoretical frameworks that the program is based on, number of sessions that the program has, again, that mode of delivery, session length. There's a table where you can view all of the different types of assistance that the program provides, including who that assistance is provided to and how it's provided, whether it's direct assistance, information, training, or referral. You can also expand these categories here. So just for an example, daily tasks expands to show just some additional, more in-depth information about those different daily tasks that programs provide assistance for. Just some additional program characteristic information. Again, that staffing, disciplines and degrees of delivery persons that can deliver the program. All of this information that you saw in the compare feature about the initial training and different training that's available for delivery persons. And then just some additional information about different tools that are available, including tools around measuring program fidelity, anything that the program manuals contain, whether or not there's record keeping systems or tools available for that program, and any other delivery resources that are available. You can view some more in-depth information about that survey of delivery sites. So again, you can see the number of sites that we surveyed for each program and the number of completed sites. Get some additional organization and program background information, such as the delivery history or the average number of months that sites have delivered the program in the past 12 months. And some additional information about program user characteristics. So who was using these programs, the number of participants that organizations served in the past 12 months, some more characteristics around persons with dementia and caregivers that they served, any eligibility criteria that they used for participants. I'm going to scroll quickly through here. I don't want to take too much time, but you can view different adaptations of the programs that organizations organizations made to deliver the program, the different languages they delivered the program in, more description on the staff that they had delivering the programs, and the different delivery site settings. Some additional site experiences that we surveyed the organizations about, again, that program impact. So whether there was perceived improvement in different outcomes, some different strategies that they used to get the resources and support that they needed to deliver the program, as well as those different challenges that they faced with resources and support. In addition, some different financial strategies and challenges that were used or faced among these sites, and the different funding sources that they used to support the program. And then finally, the research evidence. You can just get some additional detail here beyond what was in the compare feature on the different program impact and outcomes by study. So all of the studies are laid out here with the different outcomes, and you can expand these tables to look deeper into these different outcomes and whether or not they were beneficial or had no effect on caregivers and persons with dementia. And then if you want to learn more about each study specifically, you can look at the study characteristics, what type of study it was, how many people were enrolled, the different eligibility criteria for both caregivers and persons with dementia. And again, can look at those different articles and the links to articles and see specifically what outcomes were related to each article. So that's all I'm going to show here. That was just a quick overview of the site and all of the information that's included. Just encourage everyone to visit themselves again at bpc.caregiver.org. And with that, I will pass back to David.
Thanks, Rachel. I'm going to share my screen again and pass to Katie Maslow to pick up the presentation.
David, so you probably didn't know that there were that many possible characteristics of studies of programs for caregivers of people with dementia. So my job is with this program, is to find the evidence-based programs that we put into best practice caregiving. And there are three main types of inclusion criteria. So I search for programs that are for dementia family caregivers, and then try to gather the information just to make a decision about whether this program should be included. So the criteria you can see right here, the first criteria relates to effectiveness, so that all of the programs have to have been developed and tested in the United States. They have to have at least one trial. It can be a randomized control trial, a non-randomized control trial, or a pre-post test. The study that's used has to have at least one statistically significant, published, beneficial outcome for caregivers. Many of these studies have many of those beneficial outcomes, but they only have to have one to meet the criteria. And at least 50% of the sample in the study has to be dementia family caregivers. And the people with dementia have to, at least at the beginning of the research, be living in the community. So that's an effectiveness criteria. The second main criteria is feasibility, which you've heard a lot about, but this is really an important part of best practice caregiving. So we aren't just putting up programs that have research-based evidence. They also have to have at least one, what we call real-world implementation, in which the program was offered by a healthcare or community agency as a regular service for its patients or clients. Again, many of the programs in best practice caregiving now have many such implementation but they had to have at least one to get in. And then this third criteria is implementation tools, and David mentioned permission or license to deliver. They also have to have a program manual, training materials, and other delivery tools. So this is these are our criteria, and let me go on. Would you go? Okay, here's the search process. So we gathered possible programs from everywhere we could think of: journals, books, conference presentations, program developers, asking anyone who might have a program. Then we searched for published articles and contacted the developer for each program to get the information that we needed to determine whether the program was eligible for inclusion. This is before, mostly before, gathering all of the information that Rachel just showed you. We identified 44 programs that met all the criteria, and often very reluctantly, we excluded many good programs that lacked something that would allow them to meet those criteria. So some simply didn't have a published article yet, but they had everything else. Others had no research, but a great program, a great implementation, or the opposite: great implementation, no research yet. And we continue to look at those programs with the possibility that they will again become possible programs for us. There are many on our list. There are more than 60 programs that we excluded. Next slide. This is a list of the 44 programs. I know that you probably can't see it very well, but you may be able to go through quickly and see some that you recognize or know something about, or maybe even you provide some of them. As you can see here, the names of the programs aren't very helpful in figuring out what these programs are like. So you could know these programs exist and you wouldn't know anywhere near the detail about the programs that would allow you to compare them, that detail that Rachel just talked about. Next slide. So Rachel showed you this before, but within each of the categories that Rachel showed you, there are many different types and many details that are very important. As you know, this best practice caregiving was developed primarily to help organizations, so healthcare organizations and community organizations, find programs that not only are effective and feasible for them, but also match their organizational purpose, their clients' needs, and their staffing and other resources. So at any rate, this slide is looking at all of the different kinds of assistance that the 44 programs provided. I'm not saying they all provided all these kinds of assistance, but that these are all the kinds of assistance that were provided. So if you were a healthcare or community care organization and you were looking for programs, you could look at this list and any of the other data that Rachel showed you to try to figure that out. Does this program match my organization's mission and needs and resources? Next slide. As we've worked on this project, the complexity of our goal, the ultimate goal, is to match dementia family caregivers with programs that will help them. And there are many reasons why this is very difficult. David mentioned heterogeneity. Often we get asked, well, why do you need 44 programs? Why do you need more programs now? Which we do. We're going to start looking for more programs and adding them to best practice caregiving. One important reason is that the vast differences among people living with dementia and their family caregivers and the caregiving situation, these vast differences affect the kinds of help they need, the kinds of programs that they'll accept and use, and whether those programs will be effective for them. So it makes it makes it important to look for more programs to try to meet more family caregivers' needs with something that they're willing to use. This is a factor that I don't think most people think about very much, but people, everyone, and including dementia family caregivers, have sometimes kinds of help that they are willing to use and other kinds that they are not willing or not able to use. So that's an important factor. In addition to what makes this a complex project that we're working on are the, again, vast differences among healthcare and community organizations that affect the kinds of programs they can and will provide. Funders for these programs also can use this database to see which programs they want to contribute to fund foundations and other funding organizations. And they differ too in what they want and what kind of program they're able to support. In addition, caregiver needs change all the time for individuals. And if you think of the pandemic, for huge numbers of family caregivers, the kinds of services they can use were no longer, by and large, face-to-face programs, in-person programs. So that was a huge change. The healthcare and community organizations also change in their mission and their the kinds of resources they have to add programs. And therefore is this ongoing need for accurate, updated information about programs that are both effective and feasible for real-world implementation. Next slide. So David mentioned too that we're interested in looking more carefully at the kinds of programs that are available and appropriate for dementia family caregivers from diverse groups. So we look carefully through our current list, and there are 4 programs there that were developed originally for a particular racial or ethnic or cultural group. So 3 of those were developed for Hispanic family caregivers. That there are additional programs in the list that have been adapted to create programs that are intended for particular racial, ethnic, cultural, or other diverse groups. And but they are not easy to find in the database. So we're thinking now about how we can make it more clear that a program that's in the database has additional versions that some of them meet the criteria to be included on their own in best practice caregiving, and others would be useful to anyone who's looking for something for a particular group. So just an example, I don't know, some of you may be familiar with Savvy Caregiver, which is one of the programs in the database, and it is has been adapted many times, and adaptations include one that's specifically for African American dementia family caregivers, one for American Indian dementia family caregivers. This adaptation, I know Rachel showed you that the database shows what languages the program is available. Adaptation, cultural adaptation in these programs that I'm talking about involves a much deeper, more total revision to be appropriate for those particular cultural group. So we now have these 10 that are mentioned in the database, and we're looking for additional programs for diverse groups. As we look for these programs, along with other programs that meet our criteria, it will help us find what's available and perhaps even more importantly, where there are gaps in this important program area. So what we need, I think that there's a great deal of interest now in the research community and the caregiving community to understand what programs will help which people. And so, as David said, we're going to be working more on this and hope to come up with more and add them to best practice caregiving. So back to you, David.
Thank you, Katie. This is the link to best practice caregiving that Rachel showed you, and it's part of the Family Caregiver Alliance website. You can also get the best practice caregiving from the Benjamin Rose Institute on Aging website. I want to be mindful of time. I do have some additional things to share, but Alma, can you verify how we're doing on time, please?
Sure thing. We are about 7 minutes behind where we were hoping to be at this point. So just.
Okay. I'm going to quickly then through the rest of my slides and try to catch up a little time here. And what we wanted to show you next were some findings from best practice caregiving. And see if I can, no, my slides are not advancing now. I'm going to stop and reshare, see if I can get it going. And if not, I'm just going to tell you. Nope. Okay, I'm just going to say a couple things to finish up. Hopefully the slides will be available to everybody. And if you get a chance to look at the slides, what you would find are some of the key findings that we have from best practice caregiving. And we are in the middle of updating all the program information. So just as an aside to Katie's presentation, there's been some changes in programs since we launched this. And we will very soon have updated information, not only about the programs, but delivery sites. We had some key findings. One of them was that there are many more organizations delivering these programs than we ever expected. A second one was that the biggest challenge that organizations told us for implementing these programs was marketing and engaging caregivers. So we went to the service organizations. Those were the two things that really stuck out to them. And finally, we found that caregivers were accessing best practice caregiving, even though it really was designed for professionals. Those three things have prompted the next phase of our work, and we have begun developing a version of best practice caregiving for family and friend caregivers to use to find programs in their communities. So please watch for that as we move forward. Caregivers will be able to go to this website and locate programs that they can access and get all the information about those programs, plus everything that they would want to know about how to enroll, when programs are offered, where they're offered, is there a waiting list, is there a cost, all of that information. So we're planning to launch that in about a year, and we're working on it now. So I'm going to stop there and stop sharing and pass to Aaron is next, I believe.
Hi, everyone. Thanks so much for including me in today's presentation. Emma, could you make it so that, yeah, there we go. I'm going to take it to the next level with, after learning all this great information from all of the earlier presenters about, finding information on all of these interventions, I'm going to try and provide a little insight into the kind of things you need to just think about when you're selecting the intervention for your public health agency or community-based agency to implement. So next slide, please. So you get to best practice caregiving, and there's a whole lot there, and you're trying to choose the right supports and services for the people living in your community with and their caregivers. And those are a lot of decisions to make, but hopefully what we're going to help you do is figure out how to best make informed decisions so that you can actually meet the needs of your community at where they are now. So next slide, please. There's some questions that you need to consider. So I put here, as you consider your options, consider your community. One of the most important things is asking them what they want and what they need. It's sometimes we think we know what people want, but we don't ask them, and then that gets us into trouble when you're well into planning to do something and you realize that the community, there isn't an appetite in the community for what you thought that they would want. So it's super important to ask them what they want and need, and is it something that if you bring an intervention or support services to your community, is it something that your community has enough of an appetite for, that if you bring it, you will keep it there? And also, is your organization able to sustain it? Once the community embraces the services that you're offering, is your organization going to be able to sustain it? Because what you never want to do is bring something to a community and then take it away. So knowing who your target audience is if you're going in for the caregivers, are you talking about family caregivers? Are you talking about paid caregivers? There's just all the different potential audiences. And so what's in it for them? If they're paid caregivers, what's in it for the people that are paying them? So, if you're trying to get training to a home health agency so that they all become dementia capable and they know how to work with dementia caregivers or people living with dementia, how are you going to get their organization to buy into making those trainings available for their employees? And what are the outcomes? What are your expected outcomes? Is it a more dementia capable community? Is it, increased knowledge, confidence in caring for people living with dementia, all those certain things. And then also, how often do you expect to offer whatever intervention? How are you going to deliver it these days, post-pandemic or pandemic? Are you able to do things in person? Is it all going to be virtual? Is it going to be a hybrid? You certainly don't need to make all the decisions up front, but you do need to have a sense of the decisions that are going to come down the road. And another is, if in your selection of your intervention, what is the commitment that you're going to need from your program participants? Are they going to embrace that? Is it, 3 hours a week for 3 months? Will they be able to keep that going, and is it reasonable? Next slide, please. So you making those informed decisions. At ACL, we've been funding the delivery of evidence-based, evidence-informed interventions for several years now. We have a grant program. I'll tell you about that at the end of the presentation. But it's more on those making informed decisions. A couple of years ago, we created a document called Choosing an Evidence-Based or Evidence-Informed Intervention that gets to, there was a question in the chat about promising practices. That might be, and those evidence-informed interventions might be the ones that fall into that promising practice that could turn into a research project. So on our website, you'll see in the corner of this slide is a link to this document, the considerations, and it's really a list of the kinds of questions that you need to ask your organization when you're making a decision to bring something to your community. You have to know your community, and you have to ask the right questions. So, it's all about the resources, both human dollars and then the participant resources as well. Who's going to implement it for you? What are their requirements? Does it require an occupational therapist, that a licensed person, or is it something a community health worker would be able to implement for you? Or is it volunteers implement for you? And what needs to happen for it to be sustained? What does it cost? Everybody's trained? What are their training, annual license fees, boosters, technical assistance? What are the costs to start it up and to sustain it? What's happening now before you even get to that, you really need to know what's available in the community now and where are the gaps. And hopefully you're going to ask the community what's been tried in the past, what's been embraced, what hasn't, and what are you going to need to do to get the buy-in. Very important is the choices you make, being able to address the community, the cultural communities in your service area. Do they have racial, ethnic, disability, or even rural and urban competence? So those are definitely very, very important considerations. And really over the years, the cultural competence, we're getting so much better at it. ACL, we have a webinar series that annually with 10 webinars a year, and we have one coming up in March that is going to be on getting services to Asian American and Persian American communities. Those are the kinds of things, getting culturally competent services to those two communities. We certainly serve a broad range of communities through programs, but that's just something that we have coming up. The next slide, please. So let's pretend you've picked your intervention that you're going to bring to community, but then there's now what's next? And there's all of the other decisions that come behind. How are you going to get people to come to you and participate, take you up on what services and supports you're going to offer? So next slide, please. So this is something I say regularly. A lot of times we think that these services are, if you build it, they will come. You're just going to open the doors and people are going to flow in. And sometimes programs are lucky to benefit from that. They might have had some great press in advance of what they're planning to do, or they will have a waiting list of people that they know that are ripe to or have an appetite for the programs. But it's really, if it's not necessarily if you build it, they will come. You have to have a very targeted, you have to be patient, and you have to have a very targeted outreach awareness program that will build a pipeline of people to participate in your program. So next slide, please. So getting people engaged is key. It's a multi-step process. Like I said earlier, this building of the pipeline, it's multi-step. You have to make people aware of what you have to offer. It's not always that the moment you say something, a caregiver specifically is going to jump on board. They might take a minute to sit on something and noodle on it for a minute, then they'll get some interest, then they'll consider doing it. and then they'll jump on board and engage with your program. But this could take a minute. It could take, up to maybe 6 months for someone to hear about a caregiver program, even something like Adult Day. Hear about it, think about it, make it come decide whether it's right for their life, their person, making sure that it's going to work in their family and their community. But getting that engagement is where you're going to, and obviously your awareness is a much broader scope. The next slide, please. So your outreach and marketing is really, really important. You need to know your audience. I mean, it sounds like a no-brainer, but really it's sometimes we think we know, but what our community wants, but we do that without ever asking them. And then we find out that maybe sometimes we didn't know exactly what they needed. So create a campaign that speaks the language of the community you're serving. Don't expect it to be one size fit all. Use positive language to tell people how they can benefit from what you're offering. Sort of sometimes people come at it in a doom and gloom, but if you, what we've oftentimes found is that if you frame something in a way that's positive, people are more likely to, instead of saying, how to protect yourself from dementia, an education program, you say, we have a brain health program, and people are much more likely to come to a brain health program that is the same as protecting ways to, reduce your risk for dementia, but it's framed in a different way that people are more willing to embrace. So you have to engage the right partners in your community, use partners that are trusted with your target audience. And sometimes you have to offer something a little less intimidating to earn trust and get people to engage. Sort of, again, that's that pipeline thing. You're getting people to begin to trust your organization. You also have to get that marketing strategy right. Make sure you put it in a place where it's actually going to be seen and heard. When oftentimes we spend a lot of time planning projects at the Administration for Community Living in our Alzheimer's Disease Project programs initiative, trying to help people structure programs that are targeting getting the information to their audience. And sometimes, we all like to think social media is where it's all at, but that might not be our target audience, and they may not be the ones that are there. Use authentic language and messaging from people who look like them and talk like them, particularly when working with diverse communities. And again, targeting those media modes that are that your intended audience is actually using. So next slide. So everybody has a different budget. On this call, I'm most certain that there are a broad range of organizations, public government entities, as well as community-based organization. Some have actual marketing budgets and some don't. And so sometimes you just have to really get creative to get your word out. And I just listed some of the old school ways that you can get information to people. People always forget about libraries. Libraries are a wonderful place to meet older adults. Again, radios and newsletters, getting those television or to the newspaper interviews, and working with the appropriate possible referral sources in your community. This is just some ideas. And so next slide, please. And then of course, there are the people that have the budget, which is, great, and different entities. With our grant program, they can come with a budget. And so I noted here that one of the programs that we have at the Pima Council on Aging, a lovely program they did last year at the holidays, targeting families that were home meeting with their loved ones, the caregivers, people living with dementia, and they did videos. It was a tremendously successful. They saw an uptick in referrals and calls to their helplines, and it was one way to get at their people. Again, the Google ads, apparently Google has ad grants, and they help you raise awareness to recruit volunteers and things that people that have that internet or the technical ability to go through Google. That's a great resource as well. With next slide. So just some closing points. Know your audience, meet them where they are, not where you think they should be. Have a well thought out marketing and outreach plan before you launch a program. It'll serve you well. Doing it right up front can really support overall sustainability for a project down the road. And basically going back to what I said before, if you build it and then go out there and let them know that you are there for them, you have a better chance of them actually coming and building a program that your community will embrace and have for the long term. Next slide, please. I'm just going to go through, I have just a couple of other things. I mentioned before, the program that I manage is the Alzheimer's Disease Programs Initiative. We have strict state and community grant programs. That means the government entities, counties, states, and as well as community-based organizations are eligible. We have very specific program requirements, but here's some information on it. The next slide, please, is this. We do have an upcoming announcement or upcoming opportunity. It's not out yet. It will be out in the near future. Go to grants.gov to find out about it. Here's the grant number, and it should be out in the coming days and then, or the coming weeks. And then you'll have applicants will have 60 days to put together an application. It's big bucks in our world. It's $1 million over 3 years for community-based organizations, and then the states, it's 650, I think. So it's a 3-year project and well worth a look. And it's funding an evidence-based intervention, at least one evidence-based or evidence-informed intervention. Next slide, please. Wanted to also introduce you to the ACL's National Alzheimer's and Dementia Resource Center. We have a ton of great information there, as we've been doing these grants for all these years. The resources that our grantees have been developing over the years have the good stuff has been posted there, and you have access to it. Please make use of it. You'll note before that I talked about that considerations document. So when you're thinking about choosing an intervention, that document is on that website. Next slide, please. Here are just some other helpful resources for identifying the right dementia-specific evidence-based intervention in your community. And this is adding to the best practice caregiving, which we love, and we certainly send people to all the time. Our information is nowhere near as comprehensive as what they have at BPC, but our information is a great supplement to it. And we also have a ton of information on evaluating your programs and helping find the outcomes so that you can then sustain them beyond any funding that you might have. And I think next slide is my last slide. And that's it. And I will give it back to Joe, I think.
Thank you, Erin.
Thank you.
All right, thank you, everybody. Wow, this has been incredible. It's an incredible set of presentations. And I know the presenters, you probably don't have a chance to be following along on chat. I have to say the chat has been the most robust that I've ever participated in a webinar. And I'm trying to keep up myself in the chat and answering and addressing questions and everything. So we have a bunch of questions here. Thank you, Donna, and others who have been actually answering them directly in the Q&A tool. I'm going to pick out some and direct them to you. We only have around, I don't know, 9-10 minutes. So I wanted to discuss these. And I wanted to start really directing this to both David, Rachel, and or Katie. And I think any or all of you could maybe address this. One thing that's come up in the chat that I found really intriguing, and I'm sure you've given some thought to this, is the need for potentially identifying programs and best practice caregiving that not only meet the thresholds that you've established, which I think are liberal and great, in that they give providers a lot of potential options, but then perhaps thinking about, if resources permit, a section of promising practices where maybe they don't meet the threshold, but show promise to, at the very least, inform future work is needed, but or providers should be aware of. What are your thoughts on that? Maybe starting with you, David.
I'm sure, Joe. I'm sure Katie would want to add to this too. But we did explore this possibility, and to keep the task manageable, we had to come down at a certain point of inclusion, which Katie talked about. So we did relax the research criterion a little bit by allowing studies that have pre-post findings with positive outcomes, not requiring a randomized trial. And we did that making sure we included in best practice caregiving all the detail about those studies, so the user can find out exactly what kind of studies were done, what the findings were, what the positive outcomes were. So aside from studies that don't have that kind of research data, we did not include them. We knew that's a limitation, and it's difficult to put some boundaries on it, but we wanted this tool to really be guided by the research results and the feasibility demonstrated for implementation. So Katie, do you want to add to that?
Yes. So I saw someone put in the chat an idea of make the list available of programs that didn't quite meet the criteria. And when we started, we assumed that by talking to the program developer and then getting to the point of you're in or you're not in because of this, that they would want to add the thing that's missing. And I don't think that that's happened to any great extent, but I'm going to think about that suggestion from the chat because it's an interesting idea. Some of them had so little to add. Publish the article that you're sitting on, or something like that. So, great ideas. Thank you.
Great. I'm going to answer one from Diane Graham-Raff. She posed in the Q&A here is, in order to add additional programs that have been developed with a culturally specific focus, are there resources available to help get successful programs through the research and publishing requirement? Diane, I'm going to answer this directly for you. Yes, there are. And quite frankly, the resource is the Bold Public Health Center of Excellence on Dementia Caregiving. If you want to reach out to us vis-a-vis our webpage or me directly or Elma or anybody, we can help you with that if you need that technical assistance. So again, that is what our center is here and designed to do. So feel free to reach out to me when you'd like, or our center. Aaron, I have a question for you, and I thought this was a really great point, and I'd be curious to hear your thoughts. So the question that was posed was, does the best practice caregiving list indicate which programs have been approved by ACL for funding? So essentially, what I think this question is getting at is the idea of, is there a way to align best practice caregiving with the ACL recommended list of evidence-based dementia caregiving interventions? I would imagine most of what you recommend is on BPC. What are your thoughts about that?
So we have a very specific definition, but I almost want to say that best practice caregiving might be a little harder on interventions than we are. We require the randomized controlled trial. Well, actually, so we have requirement randomized controlled trial implemented, and I believe the third is published in a peer-reviewed journal. But it's outlined in our notices, our funding opportunity announcements. We also have a compendium of, we don't have a list as long as that is approved, as long as there's an intervention that can meet the specific definition. I should have included that in my presentation. I apologize. as long as an intervention meets our definition, we allow people to do it as long as they can prove that it meets our evidence base. And then we have a looser definition for quasi-experimental design for evidence-informed, and that sort of can take an evidence-based intervention, say down one step to maybe bring some cultural competence to it, and then, but it's only just one step. It's not sort of a cobbling together of a bunch of interventions or anything. We have our compendium of interventions that have been implemented by grantees since 2009, and but it does not mean that anybody, if what you want to do is on that list, is not on that list, you can't do it.
Is there a possibility, and maybe I'm opening a can of worms here, but would there ever be a possibility, I don't know if it's on the ACL site, to link to the BPC site for grantees to get more information and guidance?
I'm not sure that we link to it on our website, but we absolutely link to it several times in our funding opportunity.
Oh, that's great, Erin. Wonderful.
Yeah, it's
Wonderful.
For the last 2 years, it's been linked several times.
Wonderful.
So we link to what our grantees have done, and then we link to best practice caregiving.
Thank you. There are so many great questions. And
Joe, could I add one thing there that
Yeah, please.
it goes the other way?
Yeah.
It is that when the research developer gives me the publications that show that there's research on effectiveness, but can't name any place where it's been tested, my first step is to go to Erin's website or the staff at the NADRC and say, is one of your sites implementing this? And it often finds the answer that gets the program into best practice caregiving. So it's sort of a two-way street.
Yep.
Great.
Thank you both. I think we have time for one more question, and I'm worried, I'm not sure if we can answer this in 2 minutes, but let's give it a shot. This comes from Lycia Newman. Lycia is a researcher for Medicare MCO. They're seeking ways to improve supportive caregivers. She's impressed by best practice caregiving, but wonders if there's a similar thing for caregivers in general. So has there been thought of expanding BPC to other conditions or going beyond the dementia space, which I think is a very intriguing question. David, Katie, Rachel, if you want to tackle that.
We have thought about that, and we hope to go that direction in the future. I do want to point out that there's a good number of programs in best practice caregiving that are not only for people living with dementia and their caregivers, but caregivers in general, because many of the programs have been tested with broader populations, not just individuals dealing with dementia. So we'd like to do that in the future, but haven't done that yet.
Wonderful. So clearly this is a tremendous resource, everybody. It's one that I consistently refer people to, best practice caregiving. And again, I think there's much room for growth in it. Again, to kind of serve this key juncture between getting evidence into the real world. And again, best practice caregiving, we believe epitomizes that. So we're so glad you're able to join us today. Please do connect with us, as I've alluded to earlier. Visit us online. Our website's very easy to remember, bolddementiacaregiving.org. There, you will not only find today's recording and slides, you can also ask us questions if you have some, for example, on how to get work through the publishing piece, so it can end up on best practice caregiving. Any other types of questions you or your organization may have around the space of supporting dementia caregivers, we are there to help. And again, we will also be keeping you informed of upcoming activities and events. We are on Twitter. Please do follow us, and we will follow you back at PHCOE_DC. Last thing I want to leave you with is please put this on your calendars, everybody. We are going to be hosting the first ever national conference on the public health ramifications and opportunities of caring for people living with dementia. It's a national conference. It's free to attend. We also are offering it in a hybrid format. We'll be here June 14th and 15th at the University of Minnesota in a wonderful conference space. It'll be a nice time to visit Minnesota weather-wise. So again, we really, really hope to see you there, and please consider attending. Thanks for joining us, everyone. Please do take a moment to complete our evaluation. Otherwise, thank you to this tremendous panel. I think the best webinar we've put on, a great webinar, and I think it's providing you with tools and resources, hopefully to advance all of your critical missions that we so value. So thanks again, everybody. Hope to hear from you soon, and take care. Have a good rest of your day.